Chest X-rays are one of the most common and valuable imaging tools used in modern medicine. This non-invasive procedure uses a small dose of ionizing radiation to produce images of the heart, lungs, airways, and bones of the chest. Here is the science-based explanation of the benefits of having a chest X-ray. 1. Early detection of lung diseases. One of the primary advantages of a chest X-ray is its ability to detect lung diseases at an early stage, often before a patient experiences severe symptoms. Pneumonia, like for example, is a common lung infection, can show up on an X-ray as areas of increased opacity, where the lung tissue has filled with fluid or pus. Identifying this early allows for prompt treatment with antibiotics, which can prevent complications. Another is tuberculosis, or PTB, a bacterial infection that mainly affects the lungs, often presents with characteristic changes on a chest X-ray, such as cavitations, upper lobe opacities, or lymph node enlargement. Catching PTB early is crucial not only for the patient's recovery, but also to reduce transmission to others. 2. Identification of lung cancer. Chest X-rays are often one of the first imaging tools used to identify possible signs of lung cancer, especially in individuals who present with symptoms like chronic cough, chest pain, unexplained weight loss, or coughing up blood or hemoptysis. While X-rays don't offer the detailed imaging that CT scans do, they can still reveal suspicious masses, nodules, or abnormal shadows in the lungs. For instance, a lung tumor may appear on an X-ray as a dense area, or a round white spot within the lung field. Depending on its size and location, it might also cause visible changes in surrounding structures, such as pushing against airways or causing partial lung collapse or what we called atelectasis. In some cases, the tumor may obstruct a bronchus, leading to localized infections or fluid buildup, which can also be seen on the image. Though chest X-rays cannot confirm whether a mass is cancerous, they are a valuable screening and early warning tool. This initial step is especially important for high-risk individuals, such as long-term smokers or those with a family history of lung cancer. 3. Assessment of heart size and shape. A chest X-ray is a simple but effective tool for evaluating the size and shape of the heart, which can provide important clues about underlying cardiovascular conditions. Under normal conditions, the heart appears as a well-defined silhouette in the center of the chest X-ray. If the heart appears enlarged, a condition known as cardiomegaly, it may indicate several possible issues, such as congestive heart failure, cardiomyopathy, valvular heart disease, and pericardial effusion. Changes in the shape of the heart, or in the position of the great vessels, can also point to congenital heart defects or structural abnormalities. For example, certain congenital conditions cause the heart to sit abnormally or develop with asymmetry, which can be noticed on a standard chest X-ray. 4. Detection of air and fluid abnormalities. Chest X-rays are particularly useful for detecting abnormal collections of air or fluid in and around the lungs, conditions that can be life-threatening if not diagnosed promptly. Some abnormalities that can detect using a chest X-ray includes pleural effusion or fluid around the lungs, pneumothorax or air in the pleural space, pulmonary edema or fluid in the lungs, and hemothorax or blood in the pleural space. By revealing the presence of fluid or air where it shouldn't be, chest X-rays allow clinicians to diagnose and treat serious conditions rapidly. This ability to quickly visualize thoracic abnormalities makes X-rays an essential tool in both emergency and inpatient care. 5. Evaluation after trauma. Chest X-rays play a critical role in the immediate evaluation of trauma patients, especially those involved in motor vehicle accidents, falls, or penetrating chest injuries. In emergency medicine, they are often one of the first imaging tests performed, as they are quick, portable, and can reveal life-threatening conditions that need urgent attention. And 6. Verification of medical devices. Chest X-rays are routinely used to confirm the placement and position of various medical devices inserted into the chest or upper body. This verification is crucial to ensure the devices are working correctly and to avoid potentially serious complications. Pacemakers and implantable cardioverter defibrillators, like for example, after these devices are surgically implanted, chest X-rays are performed to verify that the leads are correctly positioned in the heart chambers. Over time, follow-up X-rays help detect any lead dislodgement, wire fractures, or device migration. Chest X-rays are essential for ensuring that medical devices placed inside the chest are functioning safely and correctly. This reduces the risk of complications, improves treatment outcomes, and provides clinicians with the confidence needed to proceed with advanced medical care. In conclusion, chest X-rays remain one of the most fundamental diagnostic tools in modern medicine due to their speed, accessibility, and broad diagnostic capabilities. From identifying acute conditions such as pneumothorax and pneumonia, to monitoring chronic diseases and verifying the placement of life-saving medical devices, chest radiography plays a pivotal role in both emergency and routine clinical care. While more advanced imaging modalities exist, the chest X-ray continues to be a first-line, cost-effective option that significantly contributes to timely diagnosis and improved patient outcomes. And that concludes our video. Disclaimer: the information provided in this video is for educational purposes only and should not replace professional medical advice. Always consult with a qualified healthcare provider for personalized guidance and treatment. Remember, your health is your most valuable asset, and investing in preventive measures can lead to a lifetime of well-being. Thank you for being a part of our community, and together, let's strive for optimal health and a brighter future. Thank you for watching. And please don't forget to hit the like button, share to your friends, subscribe to Rod Earlyseven's YouTube channel, and click the bell icon for more Rad-clusive videos.